Hello, thank you for watching this exclusive interview on Africanews. We're in Paris with Professor Rose Leke. She's one of the 5 laureates of the L'Oreal UNESCO International Prize for Women in Science. Professor Rose Leke, first of all, congratulations. Tell us about your award and what it means to you.
Thank you very much, and thanks for this interview. This L'Oreal UNESCO International Awards for Women in Science, it's very important. And for L'Oreal to put this, we're really grateful to L'Oreal UNESCO for this. What it means to me personally, at the end of my career, like I am now, I'm really honored with this prize and humbled and really pleased though. But then that's me personally, but I hope it will be a great inspiration, a great encouragement for younger women. And I'm thinking about what would they do with it, that it'd be an encouragement for them to move on, because it's not easy being a woman in science.
You're a specialist in immunology and your work is recognized across Africa. I'd like to discuss technological advancements such as the mRNA vaccines. What could be their impact in the fight against infectious diseases on the continent?
Oh, mRNA vaccines, they've really saved us a lot. And you know how important they've been for COVID. But, the good story with us on the continent is these vaccines, for COVID, they were being made outside of Africa. Being sent to Africa, we didn't even have enough. We had problems getting them. Now, last December, BioNTech took one of their very important, installed one of their manufacturing facilities in Kigali, Rwanda. So, from that, there is a lot of hope. Yes.
During the pandemic, we saw the weaknesses in the African public health system. Do we now have the tools to achieve medical self-sufficiency?
The Pan-African vaccine manufacturing drugs on the continent, that Kigali has started now already as a country on its own, but that Africa CDC is really moving it forward. If you go to the University of Cape Town, you'll find Professor Kelly Chibale there, who's using, artificial intelligence in drug discovery that he's doing. Those are the hopes that we have that will help Africa.
Regarding vaccines, as you know, Cameroon made history in January by becoming the first country to launch a systematic vaccination campaign against malaria. What does this milestone signify for you, and how do you evaluate the significance of this vaccination initiative?
Yes, that launch was really supposed to be in December, but I give credit to the government because, as you know, with vaccine hesitance and so on, they needed to put in place a good communication. In the beginning, people were thinking, it won't work out. So it was launched, and I was at that launch. And a few weeks later, I want to assure you that I went back to SOA, and I saw the numbers that they have there. It's so encouraging. In the vaccination, people have come for the first dose, mothers have brought children second dose, they've come back for the third dose. And very important, like the lady told me in charge of that area and so on, she said to me, we haven't had any side effects from it with all that they're vaccinated. That's the very good news you have from SOA.
This vaccine requires multiple doses and is partially effective at 30% according to experts. For those reasons, in some regions of sub-Saharan Africa, parents are skeptical about vaccinating their children. What do you have to say to those parents?
No, just to tell them, that the vaccine, if you go to places where the pilots were done, like in Kenya and Ghana and Malawi, if you go there, where they did the pilots for this, the mothers are so happy. I think that what I want to say to parents is, to trust this vaccine. It is working in other areas to do what it's supposed to do, less severe malaria for the children. It will help the children. It is saving lives, and it will continue to save lives.
Professor Rose Leke, thank you for answering our questions.
Thank you very much. Thanks for this.